And we are live on YouTube. It's Dr. J here in the house. Hope everyone is doing phenomenal today. We just did a podcast just a few minutes ago all on histamine and mast cell issues and the root cause. Make sure you click down below to get access to that podcast. Just kind of in summary, histamine can be a big deal in a lot of the patients that I see. I mean, clinically, I'm in the trenches. I see dozens of patients all over the world every week, and I get to see what works, what doesn't work, and we're not fully relying on research and studies to kind of dictate what we're doing. That takes decades to get that feedback in. We're using real live patient experience to provide effective clinical outcomes. That's a root cause base. So histamine can be a big deal. Histamine is a neurotransmitter essentially produced in the gut via histidine. And then we have our basophils that essentially when they leave the blood, they turn into mast cells in the tissue and they release histamine in response to inflammation or some kind of immune stressor, or actually histamine in the foods can stimulate that too. We have certain foods that are higher in histamine, like our citrus foods or our fermentable foods or our cured meats or avocados, tomatoes, eggplants. Those kind of things can release or they actually have histamine in it. And then we have histamine releasing foods. These are going to be like alcohol, chocolate, banana. They're going to be more histamine releasing, stimulating histamine release in the body, okay? And if I can give you a little bit more of a list on that, I will. So, I mean, in general, the higher histamine foods are the dried fruits like we talked about, the fermented foods, the cured meats like I mentioned, nuts, walnuts, cashews, peanuts, smoked fish, smoked meats, jerky. Dried fruits are going to be a big one like apricots, prunes, dates, figs. Fermented foods like kombucha, fermented pickle, sauerkraut. Then we mentioned the histamine releasing foods. These foods necessarily don't have a lot of histamine themselves, but they can stimulate it. Different kinds of nuts can, papaya, pineapple, shellfish, right? Shellfish, strawberries, tomatoes, wheat germ, bananas. They can stimulate histamine release. And then, of course, we have the DAO blocking foods. DAO is diamine oxidase. It's an enzyme made in the body, made in the gut, that breaks down histamine. And alcohol, various energy drinks or stimulants, different teas like mate tea, black tea, green tea, even healthy teas like green, you think would be like, hey, that's fine. No, that can actually inhibit the enzyme DAO, which can make it hard to metabolize histamine. So, of course, generalized paleo foods tend to be great with the exception of those things that I just mentioned. And people that are used to hearing fermented foods are a good thing. Well, when you have histamine issues, that's a good way to know if you have histamine issues. Now, what are high histamine symptoms? Well, it could be brain fog, dizziness, drowsiness. It could be hives or urticaria or various wheals in the skin, rashes, dizziness, drowsiness. And again, a lot of the symptoms of histamine can overlap with just general food allergy symptoms. So you have to be looking at the root cause and make sure you're getting to the root cause because it can be a little bit confusing on what issue is the root cause issue. And again, the foods may not be the root cause. It could be other things, but the foods are helping palliatively. All right, let's dive into a couple of questions here if we can. Hey, Dr. J, how can we treat lupus? Well, that's tough. It's going to be addressing autoimmune issues in general. So autoimmune disease, lupus or SLE, systemic lupus erythematosus, is an autoimmune condition, typically affects connective tissues, kidneys, etc. And why that autoimmune expresses over Hashimoto's or MS, I mean, there's probably a genetic predisposition there, right? So you don't really treat one condition differently when it's autoimmune. You just look at the root cause stressors. And the root cause stressors, obviously, it can be emotional stress. It could be diet. Obviously, gut plays a huge role with autoimmunity because, well, the data is clear, is that some level of gut permeability is going to be an important mechanism in why that autoimmunity is happening. Gut permeability, right? Tight junctions in the gut open up, undigested food, bacteria, particles get in the bloodstream that can stimulate the immune response, and that can essentially get that ball rolling with an autoimmune issue. Got to get to the root issue. How can I get my ileocecal valve working? Get to the root cause of why. So get to the root cause of the inflammation in your gut. So work through the 6 R's we talk about all the time. Removing bad foods, replacing enzymes and acids, repairing gut lining and hormones, removing infections, repopulating, reinoculating good bacteria, and then retesting to make sure it's gone. Amanda writes in, what causes pain behind the eyes and sensitivity to light? What should I do? A lot of times that is adrenal issues. Photophobia is an adrenal symptom. Get your adrenals looked at and treated from a root cause perspective with a good functional medicine doctor. Dennis writes in, I heard chiropractic says testosterone levels in men peak in October and dip in April. Is that true? I personally think they peak more in the spring to summer because vitamin D plays a big role in increasing testosterone. So I would think unless that the vitamin D is accumulating in your system and then October is the fall, so it just starts to kind of come less in regards to daylight there and summer starts petering out. Unless it's accumulating throughout the summer, I'm pretty sure it'd be early in the spring or summer is when it would start to increase. Maybe that peak stays, so it's possible, but a lot of times that has to do with sunlight and obviously it has to do with people being more active in the summer or, more active than, let's say, winter months when you're cooped up inside, so to speak. All right, hope that helps there, y'all. All right, very good. All right, any other questions, guys? Feel free to let me know. So we just chatted about the live podcast we did a few minutes ago on histamine. Really make sure you watch that. It's the previous video on the queue. And again, we'll put links down below. But we talked about some environmental things that can play a role with histamine. That could be air filtration. That could be environmental allergies. They all play a big, big role as well. So you have to kind of draw a line between which is the root cause and which isn't, all right? Very important. A couple of questions I missed here. Dr. J, do you utilize sperm testing to prepare a couple for pregnancy? Yeah, so when you're dealing with fertility issues, 40% of the issues are going to be from the women, 40% from the men, and 20% are kind of in this unknown territory. So it's easy to rule out a guy's sperm issues. We can do a sperm test and look at morphology, which is shape of the sperm, motility, which is movement of the sperm, and sheer number in the ejaculation. So that helps to kind of rule it out. So then we can put our focus on the woman. Or if there's a issue with the man's sperm being lower, then we can focus on that. Almost always it's going to be a combination of nutritional deficiencies like zinc and arginine and amino acids and CoQ10 and exposure to toxins, pesticides, Roundup, etc. I use ReproSource. ReproSource is great. I do their sperm testing. I do the advanced as well as their standard semen analysis. I like theirs because in their advanced one, they have a lot of markers for DNA damage. So you can also look at the DNA of the sperm and see how healthy it is, which is awesome. Amanda writes in, we hit Amanda already. Is 1 cup of bone broth a day enough for general health benefits? I think it's fine. Yep. I think people who have gut issues, they just think bone broth will be enough to clear it up. Probably not, but just for general health, I think it's great. Lucinda writes in, I have bacterial overgrowth. Which one of your products would you recommend? I've been using GI Clear 1 and 6. Yeah, usually a combination of 1 and 4 is a pretty good one just for generalized SIBO. And then sometimes we'll throw in 6 as well, but 1 and 4 is a pretty good generalized approach. 1 has Stimona, dill, Java brucei, Hydiotis coptis, yarrow in there. And then the 4 has a high-dose olive leaf, high-dose golden seal, which are great. It's got burdock root, which is great for the lymph, grapefruit seed extract, which is really good for yeast, and then black walnut powder, which is great for any bigger bugs and bacteria as well. Okay, excellent. Awesome, thank you. And you only run sperm tests if infertility is a known issue. Yeah, typically we're not going to run that right off the bat unless someone's curious. But if a couple's been trying for 6 months, it's good just to rule out, because there's a lot more issues that can be going on with the woman than the man, right? So it's easy just to kind of cross the man off by knowing, okay, sperm looks good, done. Then that allows us to allocate all of our attention on the woman. But if we haven't been trying for 6 months, typically we're not going to be even doing that unless someone really wants to be proactive. It just allows us to take our attention and hone it in on what the issue is. And I've seen some men who have had really bad sperm counts, and one guy just this last month, his sperm was very low, a lot of DNA damage, and we just really got his food cleaned and really got some of those nutrients up, and his sperm went up 10x. Still low, still around 10 million, but it was under 1 million, so that's a big, big bump. Do I run for all couples? Yeah, it just depends. In that category, if it's been 6 months, just to rule it out, I think it's great. Or anyone that wants to be proactive, the advanced DNA test is pretty cool because then you can see damage to the DNA. And that's important, right? Because you want to have, the goal isn't just to get pregnant. The goal is to have a really healthy baby. So if we have one person in the relationship, maybe the man who's just eating like crap and just thinks that they're okay, well, it could really motivate, let's just say, making some diet changes, like eating organic and maybe getting all the pesticides out. That could kind of allow one person to be more motivated. But if you haven't tried and the person's already really healthy to begin with, it may not be as big of a deal. I function optimally with 10 hours of sleep. Do you think this is genetic or some underlying health dysfunction? I mean, it just depends, right? How long were you unhealthy for? How long were you not feeling good? How long were your adrenals really stressed for? If it was a while, it may make sense. It's like you're got $100,000 of debt from your student loans. Now you're trying to pay it back. It's like, well, you're going to have to either work more on one side or just save more on the other, right? It's either an income issue or it's decreasing the expense issue. So you're kind of doing that in regards to your metabolic debt, right? And that could be a concern. That could be an issue. So if you feel great with it, keep doing it. Just make sure digestion's good and your diet's great and your adrenals are doing well. You can quantify it with a good adrenal test to make sure it's getting better. My cat keeps getting a benign tumor growth on this hind paw. 4 times cut out, last time amputation. Heard that a pedicure could help. What do you think? Do you mean pedicure? Like pedicure for a cat? I'm not sure what you mean. But that's interesting. I want to know why that happened. I won't say it, but did they get a VI or VACINE that drove that? Did that drive it? If not, I would look a little bit deeper at other food things that could be improved. I would look at food quality, cutting out all the dry, making sure the water they drink is super clean. And then you could try making, you can do this for some lipomas if they're like little benign tumors, is you can get like a little cotton swab, kind of dip it in apple cider vinegar and then put it on the tumor and then wrap it up. That can be really helpful too. But you want to get to the root issue. What to do about a benign lipoma on the neck? Same thing. Apple cider vinegar in a cotton swab or in a cotton ball. And then just apply it, kind of wrap it up, a bandage, so it sits there. You can even add a little bit of turmeric or curcumin there too as well. That's very helpful. And get the inflammation in your diet under control. And make sure water, diet, chemicals, insulin's under control, carbs are under control. Make sure all the right things are under control. Can you talk about your L-tyrosine dosage? Why do you use it and what dosage? So in regards to tyrosine, anywhere between 3 grams a day, 3,000 milligrams is fine. You can go as high as 9, but it just depends. If you're doing L-DOPA, hold on. So in my line, I have a product called Dopa Replete Plus, and it's got a little N-acetyltyrosine, but it has Mucuna, which is pure L-DOPA. And that actually works great. It converts higher. It converts more to it converts more to dopamine. So tyrosine goes tyrosine, L-DOPA, and then it goes to dopamine and then norepinephrine. So this helps the conversion. The more cost-effective way is just doing the tyrosine, like I mentioned, 3 to 6 grams, 3 to 6,000 milligrams. Same thing is good. Get my little dopamine support. Febendazole, eats only raw. Good. That's good. Make sure the food's organic and high quality. That's good. I'm not sure about that medication, but I would look at topically treating some of those things and make sure the chemicals are 100% good. And again, the question becomes, were they eating something bad and this is a new thing? Have we got to the root cause? Those would be really important things I'd want to kind of line up. Make sure the root cause is fully addressed. Also, with someone who needs an inhaler to clear mucus to breathe, lots of coughing, tests are normal, have started cabbage, wheatgrass juice to help my gut. Other first steps, get the gut addressed is fine. You can do a nasaline to kind of flush out your sinuses too. You can do the guanefacin, which is the herb that's used to kind of dry out the mucus pathways, but just make sure the food and the sinuses are flushed out, and then make sure there's no environmental things that are potentially causing it, right? Environmental mold, those kind of things would be important to rule out. What causes an incomplete bundle block on an EKG? I mean, typically when we're talking about the heart and then the sinoatrial node to the atrioventricular node, these are the different nodes in the heart that have to be activated. So it's like sinoatrial, then it goes atrioventricular, and then there's contraction in the atrial first with the sinoatrial, and then the ventricles are contract second with the atrioventricular node. So of course we need minerals and electrolytes for all that to work. So as long as stress hormones are not over the top, adrenaline's not over the top, we need adequate levels of potassium, magnesium, calcium, of course, and just making sure our minerals are good. So making sure we're eating enough whole foods, maybe supplementing with extra magnesium and potassium for sure, maybe having a good multi with some of the extra calcium in there as well, and then just getting to the root cause. Again, it's all about the history of how we got here. That tells more of the story. Can nano silver or binders deplete serum iron? Not sure about that. Thank you for all you do. Thank you. You are very welcome. Hope that helps. All right, any other questions, y'all? Feel free to let me know. If not, make sure you subscribe, and or any friends or family that could benefit, feel free and let them know about this great content. And if you guys want a consultation or more kind of fine-tuned support, feel free to click below and schedule a new patient consult or even an intro consult with myself. All right, y'all. Hope you guys have a phenomenal day. This is Dr. J signing off. Take care. Bye.